If you just now tuning in, hit the like, hit the subscribe, and hit the bell. GMS fam, the green room. Let's talk about it. Yo, GMS fam, the green room. What's going on, y'all? Happy Tuesday. Welcome back to the GMS show. I am your host, GMS. You know, we start out every show with peace, love, positive energy, good vibes, passing it forward, hoping that you pass it along as well. Hope everybody's doing good. I hope everybody's week is going great so far. Hope everybody's getting to the money, reaching their goals, speaking everything into existence. What up, Train 979, Brim Dog, Earth Angel, Faith, CT Reed, all in the soil. Arius Baby G. Brim said, I watched this episode of 85 South. Yeah, that's why we gonna review it today. We're gonna react to it today. We're gonna talk about this. We need to discuss. There's a lot of things going on, man. And I think it's only fair that the people that have concerns, whatever it is, can be able to ask those questions and be able to get answers to them by the so-called professionals. And it seems like a lot of the things that have been happening during this time that we've been living in involving the big C, which, you know, I can't be too censored about it because I'm going to be playing this video. And the only reason I am going to play it, though, and the fact that I'm going to be able to have them use certain verbiage is because Fauci is on there. So this could ultimately poke holes in the agenda as well. Because if I'm going to be demonetized, or if YouTube ends up blocking this video or taking it down, it's like, what are you taking it down for? This was y'all guy. This is y'all guy that's going around giving the information. So because we're having questions and we're having dialogue about it, that's what brings in the concern. That's what brings in the censorship, which is fucked up because we should be able to have questions and concerns about what's going on out here. Now, I think the guys did a very good job at asking the questions and putting pressure on Fauci the way that they should have. And we just gonna get into it, man. And because this isn't no like hour-long interview, man. The interview was probably like 20 minutes long. We are gonna, hit the pause a few times and talk about certain things, because these certain subjects shouldn't just be kind of looked over or washed over. And I know Fauci probably has all other shit that he had to do. He couldn't stay there for a whole hour, but we're going to break it down and have those questions, and I hope that you guys in the chat can participate as well and talk about the shit. So let's get into it, man. Let me go ahead and shut this music off. Shout out everybody in the chat. I see you, Black Hippie Ricky, Glittery Bubbles. All right, let's do this.
We in the White House, man.
In the trap house.
We in the White House.
This is very interesting. Shout out to hey, hold on. Sorry, I didn't do this. Shout out to 85 South Show. If you did not watch this, I recommend you go watch it. Even after watching this, just go watch it again. Leave a like. Support the guys over there, 85 South. Some incredible individuals. Let's go.
Whose house?
Man, that's the dude right there.
Yeah, man. I be watching you on CNN and MSNBC and all that good stuff.
Oh yeah, oh yeah. How you guys doing?
We're pretty good. How are you?
How are you?
Hanging in there, hanging in there.
I heard that. Well, let's get it started.
Fauci, one
All
of
right,
those
let's do it.
YIR
All right, watch
type
this.
dudes.
Welcome back to the 85 South Show. We have a super special guest checking in with us today. We never thought this would happen. Made it happen. Ladies and gentlemen, Dr. Fauci.
Dr. Fauci.
How you doing today?
I'm really well, thanks. Thanks for having me. Appreciate it.
Man, they've been working the hell out of you, man. You've been on every network.
Yeah, I know. Busy time. Tough situation we're going through.
What is going on right now, Dr. Fauci?
Well, you know, we're still in the middle of this surge for Omicron, which is that new variant. So it's really spiked up. It's starting to turn around a bit in the big cities in New York City and Chicago in the Northeast and the upper Midwest. But other regions of the country are still having a real problem with cases soaring up. We're averaging about over 2,000 hospitalizations a day, about 150,000 people in the hospital, about 700,000 cases. So we're still in a bit of an issue here with cases in some places going up, but luckily in some of the cities, they're starting to come down. We just got to get more people vaccinated and more people getting tested and more people wearing masks when they're indoors.
My question is, you know, when we first heard that you wanted to talk to us, we were kind of a little taken aback, like, why us? But, you know, now we realize, you know, the importance of, you know, our platform.
That was another thing. Now let's pinpoint this. These guys didn't reach out to Fauci. Fauci reached out to them. And when Chico said that, it alarmed the shit out of me. And the reason why it did is because when we talk about an agenda and we talk about certain things that we feel that certain entities are trying to do specifically to black people in this country, that doesn't make it any better to know that Dr. Fauci randomly reached out to 85 South Show so he can come on there to talk about people taking the V and all the other stuff. Now, I'm going to be careful on what I say because my rhetoric matters when it comes to this, and I want everybody to get this information, as many as possible. I think it's crazy that 85 South Show has 2 million subscribers and most of their videos are in the hundreds of thousands, but this video is only at 50,000. Now, granted, it came out yesterday, but this is huge. Like, this is huge for the platform to have Dr. Fauci on. And I know that it was because of YouTube that they didn't hit the algorithm as much to the point where more people came. But more people are going to come. And it's going to be because the people that are going to talk about it, people like me, people like y'all, we need to keep having these conversations. So it's just weird to me that he chose to hit up 85 South Show, a prominent group of men who appealed to the black community very heavily and who are on the rise right now, killing it, going to arenas all across the country. So what better way to get their message across than to reach a platform that can reach the masses, the black masses, so to speak.
And what we bring to our fan base and our community. But my question to you is, it seems like there's been a lot of push towards the black community for vaccinations that's a lot heavier than most other communities. Why do you think that is?
Well, first of all, if you look from the very beginning of the outbreak, for a number of reasons, African Americans in this country have had a greater risk of infection, mostly due to the kinds of jobs that they have more likely than others
fuck does
out
that
in
mean?
the community doing services in the community, which puts them at more risk. The other thing that's really important
That's an excuse.
is that they have a greater risk of serious disease when they get infected because they have a higher incidence of some of the underlying medical conditions that when you do get infected with COVID, you have a greater likelihood of getting serious disease and dying. And if you look at the statistics on a case-by-case basis, on a population basis, African Americans are a couple of times more likely to get hospitalized, a couple of times more likely to die if they get infected with COVID. So we wanted to make sure that we got our African American brothers and sisters vaccinated because they had an increased risk. And that was the reason why.
Hey, man, it's one thing government officials love to do is pander to black people when they need them to do something. My man said African American brothers and sisters. Hey, don't sleep on that. That's that I heard that the same way I heard Biden say, if you don't vote for me, you ain't black. It's the tone, man. It's like, these motherfuckers don't talk like this until they get in front of us.
We have been pushing both in the clinical trials and in the pushing for public service announcements to make sure they get vaccinated. We started off that they were less well vaccinated than the general population, but thankfully, over the last few months, the percentage of blacks who are vaccinated compared to whites, as well as Hispanics, is about even now, which is really, really good news. But we have some work to do because we know that booster shots, when the effect of the vaccine wears down a bit and it wanes, booster shots are really, really important in bringing the level of protection.
Because at first y'all said it was just that, right? Y'all said that was the thing that was going to help us out. Then it went from that to, well, you could probably still get it, but it won't be as bad. Then it went from that to, well, you need the boosters because this first thing that we giving you and the second one that we give you doesn't necessarily work all the way. It wears off. It wears off. It wears off. Hey, I'm not too sure, but somebody remind me, how many times a year do we have to get, or when do we have to get a flu shot? From the first time you get a flu shot, how long do you have to wait to get another one? Let me know real quick.
Back up so that the risk of hospitalization is less. However, we got to catch up because just like in the beginning, when there were fewer African Americans getting vaccinated than whites, and we corrected that, we got to do the same thing with boosters. So the real message now is that for those African Americans who haven't been vaccinated, please get vaccinated. And for those who have been vaccinated, get boosted, because boosting is really, really important to optimize your protection.
All right, I'm gonna just keep it all the way real with you. When the CDC came out and said they weren't gonna tell people what's in the vaccination for 75 years, that turned a lot of black people off. Why did they say 75 years?
I don't know what you're talking about. They never said that. Seriously.
That's a nigga in the interrogation room where he know that some shit happened, but he got to still hold the line to try to get out of it. I don't know what you're talking about. I ain't never heard that in my life.
I think that's myth. I mean, they said they weren't going to tell anybody what's in the vaccine for 75 years. I don't think they've ever said that, sir. You better check that.
I've been checking it.
Yeah, well,
they won't tell us what's in it.
One thing that I do know that has been said is that natural immunity has been
Why would
is
Carlos
greater
lie
than
about
the vaccine. So if natural immunity and you getting COVID builds up a greater immunity and a better, resistance to the disease and the sickness, why has there been such a heavy push towards getting vaccinations if natural immunity is so important?
Reasonable question. If you're infected and you recover and nothing bad happens to you, natural immunity does protect you for a period of time. It isn't indefinite, but it protects you. The only trouble is if you get infected, you are at a risk of not only getting seriously ill, but of dying. 860,000 Americans have died from COVID-19. those are 860,000 people that natural immunity is not going to do any good for. So do you want to take a chance of getting infected, perhaps getting very ill, perhaps dying, perhaps spreading it inadvertently to a loved one, someone in your family, someone who has a condition that makes them more likely to get seriously ill? I don't think you'd want to do that. So yes, natural immunity, if you're lucky enough to get infected and to recover, could in fact protect you for a while. But it's much better to get vaccinated, not get sick, and get as much or more protection than you would get from natural immunity.
Now, let me just point out a contradiction, because, you know, just a minute ago you was just saying how it wears off. Also, I just got done talking about how the vax doesn't even stop you from getting it. But here he just said, yeah, natural immunity, if you happen to get it and then you become fine after that, it does help. Okay, cool. I'm somebody who can speak from personal experience. I had the big C. I went through it, came out of it fine. I had mild. I did not get fucked up over the shit. I'm not saying that, and that's not me like making light of it. I'm glad I didn't go through it, because I know motherfuckers that did go through it. All I'm saying is, just right there, trying to push again the shot and say that it doesn't get you sick. Just pay attention to how they try to switch that back up.
I don't think you'd want to do that. So yes, natural immunity, if you're lucky enough to get infected and to recover, could in fact protect you for a while. But it's much better to get vaccinated, not get sick, and get as much or more protection than you would get from natural immunity.
Sir.
What is this and where did it come from? Like we're grown, 30 plus. We never heard of this. Like now the world is shut down because of this. Where did this come from?
Well, we had an outbreak of what we call SARS-CoV-1 in 2002 and 2003. And it was proven that it was a virus that was originally in the animal reservoir in a bat. And there's a lot of viruses like this that are in bats. They jump species, they infect an intermediate animal, and then intermediate animals that come in contact with humans start it. That's exactly what happened in 2002. In China, in the Guangdong province of China, we had individuals who were actually infected from an animal species and then spread it around. Luckily, we were able to control that by public health measures. The same thing happened with a less dramatic outbreak in the Far East, in the Mideast, excuse me. And that was a virus that jumped from a bat to a camel and infected a lot of people in Saudi Arabia. We don't know exactly where this came from, but it is very likely the same thing happened.
Okay, so yo. For the longest time, they had us believing that it was a bat, right? To my knowledge, and I'm assuming everybody else's knowledge in the chat, we heard about this thing starting from a bat. Now, guess what? Since motherfuckers started poking holes in how it actually happened in certain places, actually in, you know what? Let me just not say certain places because they'll catch certain keywords. But I'll just say this. Jon Stewart. I don't know if you guys are familiar with Jon Stewart. But Jon Stewart, a comedian and late night talk show host, talked about this and put it in full detail of where it came from. his educated guess of where it came from, and I would advise y'all to see that video right after this. Okay? So for them to try to act like now that they don't know how it happened is really fucking weird. They were very sure before, and they held on to this bat story until motherfuckers start talking about certain factories and different buildings in China and shit that they were doing experiments and different type of shit. But I digress. This is just what I heard, YouTube. This is what I heard. I got questions just like Chico and Carlos. All right, let's keep going.
It jumps species from an animal like a bat to a human. And in the wet markets where people come to shop for food, Usually in China and in other Asian countries, they come in contact with these animals, they get infected, and the next thing you know, you have an outbreak.
Well, question is funny as this question may sound, how come the focus hasn't been getting bats vaccinated? Because it seems like it's a lot of bats and animals and all of these type of things. So you hear that and you think, well, wouldn't it be more prudent to just worry about getting the bat population under control and before it gets to human?
Well, that's not an unreasonable question, except logistically it's impossible. There are trillions of bats in the world. How are you going to be able to capture them and vaccinate each of them?
I mean, that's very true, but it's kind of like, you're not going to have any resistance from bats like you're going to have from humans, because there's been a lot of misinformation and a lot of disinformation that's been spread amongst, like, for example, one of the questions that I get a lot from people is that, there's a certain sterilization period after vaccination. And, there's been talks of women having problems with their menstrual cycles and various things like that. So is there any truth to the fact that if you get the vaccine, you won't be able to have children?
No, that is absolutely incorrect. And one of the real problems we're facing is the misinformation.
How do you know this, Fauci? Fauci not a woman. Fauci, you aren't pregnant. Fauci, you haven't sat up there and paid attention to the women who were pregnant that got VAHEEEEEE. That's not even information that they're counting right now. So how would you know? But I digress.
Spread usually on social media.
Well, give us the real information. What's going on? Is it working? Is the vaccine working?
It absolutely is working. If you look at the data, the facts, not the rumors, not the conjectures, not the disinformation on social media, and you look at the people who are hospitalized and die, it's overwhelmingly those people who are unvaccinated. When you compare the unvaccinated to the vaccinated and look at the charts, the vaccinated people are like this. The unvaccinated people way up. A major, major difference. It's 40-something times more likely that you would die from COVID if you were unvaccinated versus vaccinated.
Well, I got to point this out as well. Because, see, you guys remember when all this popped off for like the first year, maybe year and a half? Every time you open any social media platform and looked at, like, I don't know, the trending topics or anything about COVID, you would see the death toll. You would see how many people have died from it. You would see the worst places, all that shit. Now, it's not that at all. It's between who's vaxxed and who's not vaxxed. See, he's not talking about how bad it's become in death. He's talking about the possibility of dying from it without being VAHEEEEEE. You got to pay attention sometimes to how people word things and the tendencies of what people do. First, it was the fear-mongering shit. That's why they would constantly post the numbers of how many people did. Then it got to, all right, how many people are vaxxed, who isn't vaxxed. Now we're at a point where it's like, okay, are you guys just trying to get people to take it? Like, what is actually going on? Like, I want the information on where is the people at? Where are the people at? Why are we still dying at the same rate from this thing, or has the death toll dramatically dropped since then? That's what I want to know. Don't tell me about how many people are vaccinated and how many people aren't. I don't care about that. I want to know, because the reason why you guys are pushing it is because of how bad it's been. I want to know if it's still as bad as you guys are saying it is. I still want to see those numbers. Are the numbers the same? Can they still give those numbers to us? I got to do more research. I'm not here to say that these things don't exist. I'm just saying I need to see what's going on as far as where the people are at as a whole. How are we doing in the country? Have we got into an incline as far as the death toll rising, or is it in a decline? Do we have more control over this virus, or do we not? That's what I want to know.
Those are the data. Those are the facts.
I lost my mother to COVID last year on May 4th. She passed away from it. She had an underlying condition. But
I'm sorry to hear that.
Thank you. But my question is, you know, with the masks and everything, I remember when it first started, you yourself said, well, masks is not necessary. They don't work. And then it switched to you need to wear a mask. And now it's like it went from 14 days to 5 days, and you can go out if you're vaccinated with a mask. So my question is really, what's next? Like, if we're not able to get everybody vaccinated, if everybody doesn't follow protocol, and you know it's not in contrast to what you guys think is necessary, what do we do? Do we just have to look forward to wearing masks and being able to, you know, social distance for the rest of our days, or is there some type of end goal?
Now, before he answers that question, I want to answer this. JR said, why are they just now making lynching a hate crime? Scratching my head. I know this is a little off subject, but I just want to say this. The same reason why they just considered the KKK to be a terrorist group just a year ago or a year and a half ago, whenever Trump was last in office. It's the same reason then, because they don't really hold the same weight. It don't hold the same weight no more, so we might as well just classify it as what they're saying that we know it is, and just leave it alone, because it's now in the past. We don't have to worry about it. There's no real actual KKK lynchings happening and shit like that. So we'll just leave it to what it is. We'll just say it's a hate crime. We'll make everybody happy. The woke brigade, well, you know, they'll deal with it. They don't have to worry about it. We'll set it straight for them. That's what they be doing. When they finally come to terms about how hateful this country is, by the time they come to terms with it, it doesn't even matter no more. So they'll be like, all right, we'll give you what you want now. It's not, we have bigger fish to fry. We have bigger worries on our mind. We'll let you have that. We'll let you have it.
No, absolutely not. That's not the case. We are going to get out of this. We will get out of it sooner rather than later if more and more people get vaccinated and boosted. There will reach a period when enough people will be vaccinated and boosted or infected and recover and hopefully get boosted, that the level of protection in the general community will be high enough that although the virus won't be eradicated, we've only eradicated one virus in all of history.
Smallpox.
Smallpox.
Yeah.
We'll be reading over
But
here.
we've eliminated some viruses. We've eliminated polio from this country. We've eliminated measles for the most part. So we may not be able to eliminate it, but we are hoping, and I think we can accomplish this, is to get the level of infection in the community so low that it doesn't disrupt our lives, doesn't disrupt the economy, doesn't prevent us from the normal interaction socially, going to the theater, going to a restaurant, doing things that we don't have to worry about the danger of getting infected and getting seriously ill. We will reach that point, I promise you. And
Dr.
hopefully
Fauci,
it'll be sooner rather than later.
Have you had COVID and have you been vaccinated?
I have not had COVID. I've been vaccinated and I've been boosted.
Okay. Well, the question is to you, there
He ain't had it?
realistically, you know, and this is just coming from, you know,
That nigga done
us
been
who has
everywhere,
a
done
very
everything.
big
He ain't
following
had it?
in our community. They are just people who are not going to trust the government and trust what it is that they say is
got a
necessary
different
for us
vax,
to
that's
do,
what he-
being as though the history in our community being so
He got the one that
negative
worked.
in regards to trusting the things that the government has told us. So what do you do with those people?
Yeah.
Do you dismiss those people? Do you get rid of, like, what is the plan for the people who just
No.
refuse?
Well, first of all, let me tell you that I certainly respect the community that through the tradition that has been down from grandparent to parent to children about a concern for a time in our history, which is long gone, but nonetheless is a fact of our history, of the mistreatment of communities such as the African American communities by the health enterprise. That's happened. That's something we have to admit. It's not something that we hope ever happens again. However, if you don't trust the government, and I guess I can understand that, but I wish that you would, but if you don't, then look at and learn from trusted representatives in your community, clergy, your physicians, pediatricians, people who've gotten vaccinated, sports heroes. I mean, I've been on with some of the real people that I admire in the community. People like Kareem Abdul-Jabbar, Steph Curry,
Nigga
and
said-
other people who are
Nigga said Kareem Abdul-Jabbar. I think it's hilarious because he just proved, and I don't want to sound like I got on my Hotep hat, but these are the type of people that prove to us what they think a black person is, which is a fucking athlete or like a fucking superstar, somebody who will dribble a basketball or rap on a fucking mic. Those are the people that they think all black people are like. So he's not talking about anybody like that's like a real like leader in the community or anything like that he's been talking to try to help gain the trust of the black community over this whole time. He's talking about athletes, motherfuckers who we least would listen to about anything.
really heroes of mine, and I'm sure heroes of yours, who are out there
Hey,
encouraging
listen to Chico. He said
their
Kareem
brothers and
Abdul-Jabbar.
sisters to get vaccinated. So it isn't just trusting the government. That's understandable. I'm talking about trusted messages that you care about.
You ever heard of Kareem Abdul-Jabbar?
Abdul-Jabbar.
You got Abdul. You got to put that D in there. Pause.
It
Dr.
is
Fauci.
Abdul. Sorry.
But yeah, I mean, you know, we talk to a lot of people.
I was laughing too hard the first time I heard that. I didn't hear the other part. He said you got to put the D in there. Pause. This nigga hit pause on Dr. Fauci. But nah, man, it's weird how they do that. It's really fucking weird how they do that. And I don't like that they only look at us that way. And what his definition of a real African American person is a fucking Kareem Abdul-Jabbar. He can't even fucking say his name right. Goddamn Steph Curry, nigga. Steph Curry is too busy working on his threes. He don't give a fuck what's going on with this shit.
And, you know, it's a lot of people who just, you know, don't understand the ruling. Like, if it's now to where, you know, it's been dropped down to 5 days, and I believe the reason for that is because there's so many people who are out in the community who have jobs that are servicing the community that have been out of work, and that you need to be able to service those jobs. So for the people who decide not to get vaccinated, are they supposed to be under a different type of circumstance? Like they can lose their jobs, they can, you know, lose their health care, lose all of these different things. Do you think that that's fair because they make a decision within themselves to not do something that the majority chooses to do?
You know, that's a tough one because you have to think in terms of not only your own liberty and freedom to make up your mind of what you want to do, but there are circumstances in life when you have to look at your communal responsibility. And I think that we should look in terms of each of us, you and me, our friends, our neighbors. We only have to not only worry about ourselves and our own individual choice, but how does your individual choice impact society? And do we have a communal responsibility that we're in the really tragic and terrible experience of a historic outbreak, that we have to think about not only ourselves, but our responsibility to end this outbreak?
Now, I want this shit to be over just like anybody else. But one thing I do have to point out is, what is the government going to do, or what are these people going to do when or if time passes and there wasn't some big catastrophic effect from COVID? Now, I'm not saying it wouldn't be, because I have no idea what's going to happen. I'm just asking a question that may be on other people's minds. Are they going to look back at everybody else who was talking about people making their own choice and to not take it if they don't want to take it? Are they going to go back to these people that they banned from platforms? Are they going to, like, how do you, that shit is irreversible. What do you do about that? What do you do about trying to ban or try to silence people for having simple questions and concerns about something? It's a weird time, but let's keep going.
And the responsibility to end the outbreak is really to protect yourself so that you don't become part of the problem of the spread of the virus. You become part of the solution.
Dr. Fauci, is there anything laid out for like the healthcare workers who are risking their lives right now, going to work every day, working double shifts, 20-hour shifts, being exposed to this virus? They're like really putting their life on the line for this, and they're really just getting paid hourly. And, you know, are there any like stimulus incentives or bonuses or anything like that could be in place for the healthcare workers?
Well, I hope that there are, because I know I agree with you, because these are all the people that I've work with all the time, my entire professional life, because I'm a physician too, and I've been on the front line, not at this time, I'm in a different position now. So I know what it's like to put it on the line every day to take care of sick individuals. And I agree that they are the heroes and the heroines in our society for what they do. I wish that we could compensate them more, we being society, because most of these people don't work for the federal government. They work for local hospitals and cities and states. So I would hope that we do give them an additional bonus for what they do, but I don't have control over that.
But you can help push it. Also, I just want to say this. There was a story, I don't know if y'all remember this. There were two doctors or nurses or whatever at a cell phone. I think it was cell phone. I don't know what it was, but either way, one of the people that was involved, she owned the business. It was a hospital or a clinic or whatever, and the other one was her employee, a nurse. They were going around trapping cards to people and making money off of giving people cards who just wanted cards. They made millions of dollars off of that in 1 year. Yes, that is illegal. But as you just heard right here, these are people that have put themselves at risk every day, who work 20-hour shifts, maybe even longer, get no sleep, no rest, constantly on the clock, constantly having other employees dropping off the job and having to take over the weight for everything, and having to get misinformation from the people that are saying other people are giving misinformation, not knowing when this shit's how to control this shit. Hey, man, I don't blame them for doing what they had to do to survive. Hey, if I'm putting myself at risk and I don't know if I'm going to get this shit and die one day, hey, I might as well try to do something to leave for my family before I most likely inevitably get sick and possibly die. You know what I'm saying? That's how I feel about that. But let's finish this up.
Okay. I've also read something that it said marijuana helps to reduce the effects of COVID in the body. Is there any truth to that?
There is no study that has shown that that's the case. So we got to be careful. These are anecdotal discussions. There's no study that has proven that marijuana will make things better with COVID.
Dr. Fauci, I have done my own research, sir. I have done multiple trials for the past 2 years, my good sir. And what did I say earlier? I said, yes, I got it. But I got a mild version of it. I even kept doing the show. There are still shows up right now of me with the C. Still doing the show, still functioning, still making this shit happen. And letting this be the driving force of me continuing to go. So, Mr. Fauci, I can say from personal experience and my own personal trials that marijuana does, in fact, help this dirty motherfucker we call COVID. Now, you gonna say it's misinformation? Because I'm not no scientist, but I am a scientist. And when I did my own personal trials, what I found out was that marijuana helps your immune system. Yes, that is right. That is a fact, you guys. It helps your immune system. It helps you stay out of Dodge. I'm telling you right now, it forms a green protective bubble around you so that particles can bounce right off of you. All right. Now, I didn't get the C. I've never been VAHEEEEEE at all. Still to this day, when I caught it, right, it was most likely at a time, right, when I had a gap between smoking a joint, and I probably ran to the store or something and just so happened to run into somebody that probably had it, and then it had enough time to not have to go through the force, the bubble, the protective marijuana force bubble, and it got to me. But as soon as I got home, I smoked something, and then, you know, it was like, oh, I got a mild version of it. Now, like I said, I'm not a scientist, but I'm a scientist. And I did my own trials, Dr. Fauci, and I will confirm that what Chico just asked is a fact.
Do you think we need to get a study started?
I wouldn't be surprised if there already is a study looking at that, as a matter of fact, because there is a thing called long COVID, which when you recover from the acute stage of infection, a substantial proportion of people, it can be anywhere from 10 to 30 or 40%, have the persistence over weeks and sometimes months of rather debilitating symptomatology, fatigue, really profound fatigue that interferes with your ability to function, muscle aches, sleep disturbances, psychological issues, inability to concentrate. A lot of different studies are being done to see what is the underlying mechanism of that, and is there anything we can do to treat it? So I'm sure there are going to be a lot of clinical trials trying a lot of things. I don't know if marijuana is going to be one of them. I don't know that.
It should be.
But I wouldn't be surprised if it were.
Let me answer this. Ralph S. said, what happened to pneumonia and the flu? We don't hear about that anymore. You want to know why? Because pneumonia and the flu got together and they fucked, and then they made COVID. So, yeah.
My last question for you, Dr. Fauci, I know we got to wrap it up, but prior to all of this stuff happening, healthcare was a big topic of discussion. A lot of people still didn't have adequate healthcare. And now a lot of people are getting COVID without adequate healthcare. Like, is anybody studying the long-term effects of COVID? Like, I know a lot of people are discovering, health things after having COVID that are long-term, and they're not going to be able to get access to, to healthcare.
Well, that's a really great question. And we've invested $1.12 billion in studying just that. What are the long-term effects, the post-acute COVID syndrome effects? And we're looking at cohorts of tens of thousands of people trying to figure out what the long-term effects are and what we can do about it. So that's a great question, because that's what we are addressing.
My last question to you, Dr. Fauci, is unfortunately, a lot of the general public don't have the opportunity to sit and talk to you directly. So my question is, for those people who may have doubt or may feel, inadequate about the process that we're going through now, what are some of the local programs and local people that are set up that they can talk to and hold responsible for the way that they feel about this brand new thing that we're all figuring out as we go? Like, where can people go to get answers that might not be able to talk to you?
Facts. They can get facts.
They can get facts from regarding this pandemic and this.
Of course,
this
he'll say this.
Well, I would think the best place to go, I go there myself to get information, is you just go online to cdc.gov. The Centers for Disease Control and Prevention, which is the premier public health institution in the world, has really the facts that you need. They have a search engine. You go to cdc.gov, in the upper right, there's a search bar. Click in the question you have, and it directs you to hopefully will be the answer that will help you.
Gotcha.
Well, we really appreciate you taking time out of your day to talk to us and give us the information, directly from you. And we appreciate it, Dr. Fauci.
Thank you.
Right, thank you. Good.
Now, we have to have a quick discussion about this, man. For one, like I said, I don't like the fact that it was only 20 minutes, but there was so much to unpack in that whole shit, because Fauci was saying a lot. It felt like a lot of the shit he was saying was scripted. Not even just like it. Somebody said earlier in the chat, it looked like Fauci was talking with somebody behind the camera with a gun to his head or some shit. Now, I get it. You know what I'm saying? He's doing what he has to do. You know what I'm saying? Protect his interests. And hey, as a matter of fact, he has more knowledge than we do about everything, because he's more plugged in with what's actually going on. So I'm not gonna try to discredit Fauci in that way. I just know that there has been a lot of information given to the public, and a lot of shit has been changed up since then. Now, I get it. Things are subject to change. People jump the gun. They want people to trust them right away. They want the trust of the community off the bat. But what they tend to do is shoot themselves in their foot. And it ends up being a case where people end up inevitably not trusting them. See, instead of them waiting to get all the facts about everything that was going on, they were trying to rush to get people to trust them. So now it just looks like they keep lying about shit. I don't doubt the virus. I know it's real. I had it. Everybody around me in my life has had it. We're just at a point now where, like I said earlier, I have questions. Is it as bad as it was a year ago, 2 years ago? Is it more under control? Are more people not being hospitalized over it? What's happening when it comes to the regulations and the things that we have to do? My daughter's school just today, they just dropped the mandate of kids having to wear masks on the bus today. So now kids don't have to wear masks on the bus today. But what were we just hearing from Fauci on here? This ain't over. Apparently, this is still going to be something that is going to affect us if we don't get it under control, or if everybody doesn't get vaccinated. So why are we relaxing on the rules? I just went to a concert last week. That was super packed. Sold out arena. That was at first supposed to be, hey, you gotta give us a recent negative test or bring in your vax card. And then the rules changed, like, fuck that. We ain't gotta do that. How serious are y'all really taking this shit, man? The rules are relaxing, but y'all are still rushing people to go and take it. I'm confused. You should understand why I'm confused. You're rushing people to take it, but the rules and regulations and mandates are kind of getting loose out here. I am confused. But either way, I just hope that all this shit gets under control and we can get back to life the way that we need to, man. This is what is this? 2020 summer, 2021. This is gonna be the third summer in a row where we are gonna have to deal with this shit. But I'll tell you one thing. Soon as spring hits, soon as it get warmer, I'm outside damn near every day. I'm not gonna waste no time, and I hope y'all don't either, man. Take advantage of being outside before they try to trap us in this motherfucker. Before they find a reason or an excuse to be like, oh, shit's out of control. Y'all just go outside, man. Get some fresh air. Get as much fresh air, sunshine, my melanated folks. Get as much as that as you can, man. I promise you. Now, GMS fam in the green room. It's been a beautiful, beautiful show. I hope you all hit that like button. Did you hit that like button? I hope you hit that like button. It would mean the world to me. Also, help GMS, support GMS by leaving a like, leaving the subscribe, hit the subscribe button, hit the bell, get the notifications, leave a comment on the video after it goes down. I'm telling you, that's the best way to keep your boy out the shadow realms, especially for this episode. So make sure y'all leave a comment under the video when this live is over. Follow me on my socials. I follow everybody back. Hit the Cash App today if you are feeling generous. I would most appreciate it. Another way to support the GMS show. Put the GMS in the comments. If you did not participate in the chat, now is your time. Let me see them GMSs. I'm finna shout y'all out. Let's go. Shout out Ralph S. Brim Dog. I see y'all, GMS fam. Toke Champs Podcast in the building. King Lukey in the building. Areas Baby G. Oh, I know that's in for sure. Vale in the building. Earth Angel Faith in the building. Marvin Thomas in the building. Glittery Bubbles. Burn that shit. Yo. Ron Brown in the building. Stay safe out there, man. Keep your immune systems right. Get your daily medicine. You'll be all right. Appreciate you, JR. Posted them links. Make sure y'all hit those links and support GMS that way as well. D. Edie in the building. Oh, and drink lots of water, please. I know every time y'all see me on this show, I got fucking water with me. Make sure y'all drink y'all water. It is essential. Hey, get that money, Earth. Man, I'm high. I am high. Which means I'm safe. Because it helps. All right? I am the messenger. If there's somebody to give you facts on what marijuana does for the body and the soul and the mind, it is me. I am your Kush guru. All right? I promise you. John Jones, I see you. GMS fam, the green room, I appreciate y'all, nigga. We out.